Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. We're just going to wait a couple more minutes to make sure everyone has attended this webinar. Thank you. All right. Well, hello, everyone, and thank you for joining our COVID-19 Protocols and Procedures webinar. An employee tests positive for COVID-19. Now what? My name is Sylvia Kolotsopoulos, Head of Brand Strategy and Business Development at Hazmasters, a subsidiary of WESCO, and we are a sister company of our U.S. counterpart, Connie Safety. We are very grateful to be here today to share our best practices when it comes to keeping your facilities and employees safe during these times. It's also very personal to us. So here's the agenda. Before I get started on the agenda, I'd like to say, on behalf of WESCO and our subsidiaries, thank you to our frontline and essential workers. And for those of you who have been personally affected, we are with you. We are in this together, and we hope we see the light at the end of this tunnel very soon. So as you can see on today's agenda, we're going to have some quick introductions. We're going to discuss COVID-19 facts and updates, touch upon preventing COVID-19 in the workplace response protocols, the IICRC and the benefits of restoration contractors, a Q&A, and talk about the new normal webinar. So quick introductions. As you can see here, we have our webinar panelists. I'm joined here today by Matt Nichols and Karen Donnelly, our subject matter experts. Matt, please tell us a little bit about yourself.
Thank you, Sylvia, and thank you everybody for joining and giving us this opportunity today. My name is Matt Nichols. I've been with Hazmasters for over 22 years now, and in that time I've exclusively worked with the restoration and abatement industry, working with customers and vendors to bring new products and new technology to the market to make the cleanup and removal process safer, more innovative, and more efficient. So thanks again for having me.
Thank you so much, Matt. Karen Donnelly, please tell us a little bit about yourself.
Sure, thank you, Sylvia. Good afternoon, everyone. My name is Karen Donnelly, and I'm a Canadian registered safety professional, and I have over 20 years of experience in health and safety roles, supporting companies in both Canada and the United States. I've worked in a variety of business sectors such as oil and gas, pipelines, mining, chemical management, consulting, and a few other industries. I am now the National Health, Safety, and Environment Manager with Hazmasters, and I'm happy to be joining all of you today for the webinar. Thank you.
Thank you so much, Karen. Unfortunately, Carrie Vermeulen was unable to make our webinar today, but I'll speak to some of the IICRC points. Try saying that 3 times. So a little bit about us before we get started. Hazmasters, some key points. Hazmasters, our tagline is creating safer work environments. We're a subsidiary of WESCO, have been a safety leader in the restoration industry for 30 plus years. We're a provider of safety and IICRC training, safety products and equipment to the restoration contractors and various industries. Our industry recognized IICRC training provides certification for the inspection, cleaning, decontamination, and air cleaning of workplace environments. And about Connie Safety, has been in the business for protecting workers for over 70 years. They have been a part of WESCO since 2012. Providers of safety products and services, including safety, training, and consulting. Together, we are WESCO's North American safety arm. So let's talk A little bit about COVID-19 facts and updates. So I'm sure some of you know this, most of you know this, but you can never know it enough, especially with what's going on at this time. So COVID-19 is an illness caused by a coronavirus. The human coronaviruses are common and are typically associated with mild illnesses similar to the common cold. Symptoms of human coronaviruses may be very mild or more serious, such as fever, cough, heavy breathing. Symptoms may take up to 14 days to appear after exposure to the virus. Coronaviruses are most spread from an infected person through respiratory droplets, when you cough or sneeze, close personal contact, such as touching or shaking hands, touching something with the virus on it, then touching your eyes, nose, or mouth before washing your hands. So I have to say, we presented this presentation to the ISM Association on April 7th, and the stats back then were at 300,000 active cases. And I have to, it's interesting how many more cases have developed since then. So here's some interesting facts to share. So as of today, and the numbers keep on changing, the United States has over 849,000 reported COVID cases. In Canada, over 40,000. So here's a very, very interesting fact to be aware of. 10% of American workers are employed in occupation where exposure to the disease or to exposure of a disease or infection happens at least weekly, and 18.4% where exposure happens at least monthly. So if you put it into perspective, in the United States alone, 14.4 million workers could face possible exposure to COVID-19 at work once a week, and at least 26 million at least once a month, according to this new study from Statista. So as we are aware and continue to be aware of these large numbers, we are seeing headlines like these across North America regularly, where key industries are being affected and impacted by the spread and the contamination at their facilities, like Wisconsin just recently, all these headlines. So this is why it's very, very important to have these procedures and protocols in place. As Hazmasters, we are creators of safer work environments, and this is why we're here. So let's talk about preventing COVID-19 in the workplace. Did you know that the virus can stay active on these surfaces for this amount of time? So copper, 4 hours. In the fridge, 2 to 3 days. Plastic, 2 to 3 days. On steel, 2 to 3 days. In the air, 3 hours. Clothing, 3 hours. And paper and cardboard boxes for 24 hours. Think of all those surfaces at your workplace. So let's talk about proper workplace hygiene and practices. So to practice good hygiene, hand washing is the preferred method, and hand sanitizer at the workplace. 20 seconds or more, sing happy birthday a few times. Respiratory etiquette, cough and sneezing into your upper sleeves, use disposable tissue, and then wash again. Cleaning and disinfecting measures, read the label, follow the contact time, and that's the amount of time the surface is to be visibly wet before wiping. Increase cleaning and disinfecting measures for branches with special attentions to shared areas. We have branches, but it could be offices or facilities to you. Disinfect high touch points in the facility. Create cleaning schedules and lists to ensure all areas are covered on a regular schedule. Personal PPE assigned to each staff member. Avoid sharing office supplies. And practice social distancing. Follow social distancing rule of at least 6 feet between employees and customers, and limit customer interaction at every touch point. So at Hazmasters, we have developed our own workplace response protocols. So Karen, as Health and Safety Environment Manager, what can the attendees today do if their facilities or employees are exposed or test positive to COVID-19?
Thank you, Sylvia. Yes, I'm going to be talking to you today during the webinar about employee exposure procedures, being prepared at your workplace for the COVID-19 pandemic, and some procedures that we have developed at Hazmasters for our workplaces. These procedures are being provided to you as examples only, and your company will need to review your risks and put controls in place to meet those risks. So I'll start off by saying that the procedures that I'm going to be sharing with you today are also available as handouts at the webinar site for you. I want to start off by saying, before I get into discussing these procedures, that we have developed them using guidelines that we received from the local legislators and Centers for Disease Control and Prevention, the CDC, and the World Health Organization, WHO, and then other reputable health organizations. So first off, what do you do if an employee within your facility is exposed? So immediately remove the individual who is tested positive from the workplace. You would need to promptly identify and isolate any potentially infected individuals. These individuals would need to monitor their symptoms for 14 days and contact their local health authority if symptoms develop. So in the US and Canada, there's a little bit of a difference there in the requirements. So potentially infected individuals in the United States are allowed to continue to work, but they have to meet certain requirements. And some of them are, they would take their temperature before going to work. The employer would take their temperature when they got to work. They would need to wear a mask, things like that. Whereas in Canada, in case you have offices in Canada, these individuals are not allowed to return to work. They have to self-monitor for 14 days. So a little bit of a distinction there. So in the event of confirmed or possible exposure situations, workplace procedures need to include a thorough disinfectant cleaning of the facility from a certified company. You would need to determine where the affected person had been working in the workplace to ensure that those areas receive a thorough cleaning. And if it's not possible to send any potentially exposed individuals home, isolate the contaminated areas with industry standard procedures to allow for the decontamination team to clean the area. So some essential services would be such as first responders like fire department, EMS, police. So they would fall into this category of not being able to be sent home. Some additional essential services would include medical clinics, grocery stores, financial institutes, organizations like that. But I can't stress enough how important it is to continuously check your local regulators and your reputable health organizations for updates, because as you know, things are changing daily. So workplace preparedness. Workplaces need to be ready to be able to respond to pandemic situations such as COVID-19. Ensure you have a workplace preparedness plan or pandemic plan in place and implemented. The following are guidelines that we have established at our workplaces. And again, these are to be used as examples, and you will need to determine what will work best for your company. So create a work from home roadmap with best practices for your business. Ensure the workplace follows a two-team approach for those employees that must remain in the workplace. So to prepare our facilities for possible COVID-19 infection of an employee, we established the two-team approach. So both teams are staffed to run all aspects of our operations. These two teams work at 2-week intervals, one team working in the facility and the second team working remotely. And again, a two-team approach guideline is one of the documents that will be downloadable from this webinar site. And then ensure disinfectant cleaning in between shifts and use different washrooms if possible. Separate the warehouse employees from front office employees to avoid potential cross-contamination. Do not allow visitors into the facility. Follow a process of transactions being completed over the phone or online. And then have a ready kit for those employees who have to visit clients, for example, HVAC emergency services. So this would include such items as hand sanitizer, mask, safety goggles, glasses, disposable gloves, sanitizing wipes, and then a garbage bag. The next two slides cover control procedures for office and warehouse environments that, again, we have developed for our workplaces, and we're sharing them with you today. You'll just need to take a look at them, review them, and see if what part of them will work best for your company. I'm not going to go over every bullet within these two procedures. As you can see, there are quite a few. However, these two documents, again, are downloadable on the webinar site for your reference. So the first procedure I will cover is the pandemic control procedures for office environments. So some highlights of this procedure are that showrooms are not to be accessible to the public. Doors are to be locked. Post a sign on the doors advising customers to call the office for service. No in-person, cashier on delivery, or credit card payments. A telephone credit card transaction is acceptable. No visitors are allowed at the facility except for authorized government or emergency personnel. Hand washing signs to be posted and hand sanitizers to be used when necessary in between hand washing. Wipe down workspaces throughout the day and increase cleaning and disinfecting measures. And now we move on to the pandemic control procedures for warehouse environments. Some highlights of this procedure are restrict access to the warehouse, limit customers and couriers to ensure a 6-foot distance is maintained. Others are to wait outside to be served. Doors are to be locked or closed to be able to stop and monitor traffic. A quarantine area to be established at the warehouse door for 6-foot distancing to customers picking up orders. Visitors or customers are not to enter the warehouse past the quarantine area. They must use a hand sanitizer and then disposable gloves when entering the warehouse quarantine area. And finally, limit the interaction between warehouse staff and customers. For example, orders placed over the phone, no signatures required on deliveries, the name provided is sufficient, and staying within the quarantine area. So I hope these procedures were informative and will help you to develop your own company-specific procedures. Thank you very much, and I'll turn it back to Sylvia.
Thank you so much, Karen. And again, folks, all this information will be available to you at the webinar. You download it, and also follow-up emails, and you can visit our sites. So I want to switch gears a little bit and talk about the IICRC, which stands for the Institute of Inspection, Cleaning, and Restoration Certification. So the IICRC and why it matters. The IICRC, founded in 1972, is an organization, and again, Institute of Inspection, Cleaning, and Restoration Certification. It has established globally recognized standards for inspection, cleaning, and restoration. Why does that matter? Because we are dealing with an unprecedented deadly virus, everyone. So it's our duty to just share our information with trying to help you find the highest standards to mitigate the risk at your facilities. The IICRC is also an ANSI member with over 60 active certified technicians globally. ANSI, of course, stands for American National Standards Institute, responsible for overseeing the development of national consensus standards and verifying that the requirements for due process, consensus, and other criteria for approval have been met. Some basic principles about the IICRC: they're providing accurate and legitimate information to affected consumers and following strict standards of honesty and integrity, require their technicians to undergo ongoing education to stay current on latest industry techniques and technology, and carrying adequate liability insurance to protect the consumers, the companies, and their parties. So I'm frequently asked from customers, industry peers, and colleagues on what the benefits are of hiring a restoration contractor to decontaminate facilities. So Matt, you have over 20 years of experience working in restoration. What are some of the benefits that you can share with the folks who are considering using a certified restoration technician during this time as part of their pandemic control procedures and protocols?
Yes, thank you, Sylvia. And we really wanted to drive home the importance of using a true pro and a certified restoration contractor to do your COVID-19 cleaning. There's a lot of contractors out there, or people claiming that they're right for the job. So we wanted to kind of point out the true benefits of going with a true professional. So as Sylvia mentioned, the IICRC and the high standards that they put out, restoration contractors, they have their employees trained by certified IICRC instructors, like Carrie Vermillion that works for Hazmasters that Sylvia mentioned earlier. So their employees are all trained with the proper PPE and decontamination protocols. So not only are they using the up-to-date personal protective equipment and keep their employees safe, but the donning and doffing of the personal protection equipment is most important to make sure it's done properly, so you're not cross-contaminating areas. They have extensive experience performing removal of biological contamination, including avian flu, sewage, trauma. And why that's important is it's very similar procedures to the COVID-19 when you're cleaning, or when they're cleaning. You know, sewage and trauma could have viruses and diseases. So they have a ton of experience doing this, and it's very, very important they follow the proper protocols. They have the ability to scale across a large footprint efficiently, so less facility downtime and employee peace of mind. And to give you an example, we had one of our facilities where one of our employees had a possible interaction with a third-party person that possibly had COVID-19. So they shut down the facility at 3 p.m., sent everybody home within 2 or 3 hours. The restoration contractor was at our building. They cleaned up overnight, and we had all our employees back the next day at 7:30 to continue business. And so there was only 2 hours downtime, and all the employees had the peace of mind that the job was done properly. These contractors also use certified and commercial grade cleaning equipment. So where this comes into play is if they're containing an infected area and they have to build in containment and have negative air pressure, they're using the proper HEPA certified equipment to make sure the job's done. They use proper cleaning techniques, including removing the source by grid style cleaning with the approved disinfectant and cleaner. So what grid style cleaning is moving in straight lines, back and forth, overlapping slightly to make sure they're getting every square inch of that surface, and using proper disinfectant and cleaners to make sure that they're removing the dirty source as well as disinfecting, and following proper labels to make sure dwell times are used properly. These contractors they exercise cleaning towel care. So what that means is they're not using the same rag, wipe, or towel to wipe multiple surfaces, or dip dirty towels back in the cleaner or the disinfectant for cross-contamination. They're doing it properly and using a clean towel. They focus on constant contact surfaces and equipment, telephones, keyboards, door handles, bathroom fixtures, equipment controls like forklift controls, all the hard contact surfaces that people are going to touch a lot in high traffic areas. They concentrate on those. They have access to approved disinfectant and commercial grade equipment. So depending on where you are, whether it's EPA or Health Canada, they're using the top-notch approved disinfectants and cleaners and all the up-to-date commercial grade equipment to make sure the proper protocols are followed and the job's done safe. They have existing partnerships with environmental hygiene professionals to, again, make sure all of the proper up-to-date protocols are followed. And if there's testing needed done afterwards, they would be there right away. And last but not least, these certified technicians, they clean first for health and second for appearance. They're not coming in just to shine up some windows and make everything look good. They're cleaning for your employees' health, and that's most important. So again, thank you very much. If anybody needs any recommendations of a true professional contractor that's certified in your area, please reach out to us. My name's Matt Nichols. I'm on LinkedIn. You can also reach me at matt.nichols@hazmasters.com, and we'll provide all that information after the webinar. But we're here to help for sure if anybody needs any recommendations. So thank you. Sylvia, back to you.
Great. Thank you so much, Matt. And if I could, again, certified technicians, they disinfect for health first and appearance after. So that's very, very, very important, especially during these times. And again, we're doing our best to help flatten the curve and educate and share our best practices and protocols. That said, we're at the Q&A portion of our webinar, and we've been receiving many, many questions, as you can imagine, and we'll try to get to most of them. And the ones we don't get to, we will be following up with all the answers in an FAQ sheet as well. So let's get started with some of these questions. How will COVID-19 change the way we conduct first aid? Karen?
Sure, thanks, Sylvia. Actually, this is a great topic and one that we have just been discussing internally at Hazmasters with our safety trainers. So because of the pandemic and the virus being able to spread through droplets, health organizations have changed up the process, allowed to do first aid, CPR AED Response. So what the change is, so of course CPR is with breaths and compressions, but because the droplets can spread, what they are recommending, if you don't know the individual or don't feel comfortable in giving mouth-to-mouth breath, what you can do is, of course, follow the regular process of 911 and requesting the AED, but then you wear a mask. You put a mask on the casualty. If a mask is not there, they're saying to lay a towel or a cloth or a piece of clothing or something over their mouth. But I would be nose and mouth. But I would be cautious about that and make sure it's not too heavy or too thick of a material, because then it would affect their breathing, and you don't want that with a heart attack casualty. So then what you would do is you don't do the breathing part of it. You just continue with chest compressions until the paramedics arrive. So that is the difference, is that you don't have to do the breath. You just do the chest compressions. And what I found as well is that the American Heart Association had a really good poster that explains this and has pictures. And I think it would be a good idea to communicate it out to all the employees, especially your first aiders, so they're aware of this change, because I'm sure they'll be feeling a little uncomfortable if they have to respond to this type of an event. Thanks, Sylvia.
Great, thank you, Karen. Have a few more for you, I would imagine. Yes, so what would I need to do if we have a service company come in to do an urgent repair at our facility?
Okay, another good question. First off, with any contractor coming into your facility, you have to make sure that they are on your approved list of contractors. And then what I would do is I would ask them if they have, now you can't ask them if they have COVID-19 or had COVID-19, but you can ask them if they have any symptoms or if they have been recently exposed to anyone who has symptoms of the virus, because you wouldn't want those individuals coming into your facility and potentially affecting or infecting your employees. So you could ask them that. So you would do all this before they actually come into your facility. As a precautionary measure, you could ask them to wear a mask during the time that they are in your facility. And then have a discussion with them as to how they're going to be doing the task. This is normal questions and preparing for a contractor to come in. You're just adding the virus component to it. So you'd ask them how they're going to be doing the work, what personal protective equipment they're going to be using, and then if their tools are being disinfected prior to going into your facility. I know with construction and contractors that this is a requirement in order to go into other facilities. So ask them if they're disinfecting their tools and equipment, and then make sure that they're practicing, the proper hand washing protocols and social distancing. I would make sure that they are not coming in contact with your employees. So communicate to your employees that they are going to be coming into your facility, and then make sure social distancing is applicable. I guess I'd finish it up by when they leave the facility to make sure that all the high touch areas have been cleaned. Because as you know from the presentation, the virus can last quite a long time on certain surfaces. So you'd take a look and you'd wash the door handles, any high touch point areas, the equipment they were working on, things like that. I think that about covers it, Sylvia.
Yeah, no, great, thank you. I know we touched upon this one, but we have another question to it. So how does a two-team approach work? And again, we're utilizing that system at Hazmasters. So Karen, I know you're the perfect person to answer this one. So how does a two-team approach work?
For sure, yes, I did cover, I think, part of it during the presentation, but the way we have it set up internally here at Hazmasters is we took a look at the number of employees actually required to run the operations fully, and which employees we could have working remotely at home. So from the number of employees that we needed to have on site within our facilities, we broke it down into two teams. And the reason for that is that if one team becomes infected for some reason, we had to quarantine them, then the second team is still available. So we broke it up into 2-week increments. So one team works in the facility for 2 weeks and the other works remotely, and then they switch. So that is good, and it's been working out well. What we also do is before the second team comes back or comes into the facility, we make sure that the whole facility is cleaned by our staff, high touch points especially, because we don't want to cross-contaminate from one team to another. And then, of course, if there is a quarantine issue, then we would get a certified cleaning company to come in and clean our facility before the other team comes in. So I think that explains it, Sylvia.
Yeah, no, that's great. Thank you so much, Karen. I have one for you, Matt. Does Hazmasters offer decontamination services and decontamination supplies?
Yeah, so thank you, Sylvia. So the services, as we mentioned, we would recommend to go to a certified restoration company. So Hazmasters doesn't actually do the service, but we do, however, provide the PPE to the restoration contractors as well. Hazmasters and Connie Safety diversifies in a lot of markets such as manufacturing. We're currently providing frontline workers with PPE, the construction market, mining, the food industry. So a ton of different things that way for sure. But no, we would definitely recommend a restoration partner for the actual cleaning itself.
And we definitely have partners at Hazmasters. We have key partnerships with certified national restoration contractors. For those of you who are interested. And of course, we are the largest safety provider of the IICC training, just to make a little point on that. So Karen, I have a one for you. What are proper care instructions for using cloth masks? That's a good one.
That is interesting because that is becoming more prevalent in the news and in guidelines from like CDC lately. Right now, CDC is recommending it as a voluntary measure, being that because of the research and the trending, it's showing that asymptomatic or individuals who do not have the symptoms yet can still spread the virus to others. That CDC is recommending individuals wear a mask or cloth mask when they're out in public in areas that social distancing is hard to attain, like grocery stores, places like that, or in areas of high risk that they've been encountering large number of positive cases. So again, this is just a voluntary guideline, but I can see as our states and provinces are starting to reopen for business, this might become a requirement. So again, just keep checking with your regulators and your health organizations to see what the latest guideline is. So I have done some research on cloth masks because personally I have ordered a few for our family. So it showed that cloth masks are not to be worn, I think it said for about 30 minutes at a time, because your breath will dampen it, and then it becomes the mask will become less effective. So if you're wearing a mask, be careful about that, the cloth mask. And then recommendation is just to wash them in a regular washing machine with a bleach component to the laundry detergent, which will clean the virus better than just the regular detergent. And to use as hot of water as the fabric can take. And then again, they just say to dry it in a regular dryer at, again, as hot a temperature as can be attained by the material.
Great, Karen. I have another one for you, and it almost comes to the theme of the whole back to work situation with this question. Are employers permitted to take employee temperatures prior to their shift?
Oh, that's another good one. I've done some research on that one as well, because when I heard that, I didn't think we were allowed to take employees' temperature. However, under normal circumstances, you're not, because it's classed as a medical procedure and employers are not allowed to do that. But again, because of the pandemic, allowance has been made for employers to be able to do that so that we can get our employees back to work, but keep everyone safe. So CDC is recommending that an infrared digital thermometer is used because this way there's no close contact in the individual who's being tested and the one who's testing. And social distancing can be attained that way. Also make sure that the information is confidential, so you wouldn't want to line up your employees and start doing temperature reading, because then other individuals might potentially know and find out that someone may have a fever. And also make sure that you involve your human resources department, your HR team, because you'll need to know and determine your own company policies as to what to do with the individuals if they do have a fever. Are they sent home? Are they allowed to work? Do they have to take vacation time or sick leave, or are they being paid? So ensure you involve your HR team on that decision as well.
Great, thank you, Karen. Matt, this one's for you. Does your company have a list of approved certified restoration contractors for the US and Canada?
Yeah, so absolutely. We have a ton of great partners in Canada as well as the US. So I think we'll be providing our information after emails, and everybody's welcome to reach out to me on LinkedIn, or again, send me an email. We'll provide that information. But yeah, absolutely. Once we know the area you're in, we could find someone that's local and can respond very quick to you, and we'd be happy to help you out for sure.
Great. We've been getting a lot of questions, and you know what? It's hard to sift through it and be as organized as we want to be for this call. So what I'm going to do is that we're going to ensure that all the questions we're receiving at today's webinar will get all properly answered and will be followed up with everyone here who attended. So thank you so much for your interest and your questions. So, and again, Matt and Karen Donnelly, I want to thank you so much for your insights. We spoke about earlier the new normal. So with Hazmasters and Connie, as you can see here, there's going to be an actual webinar coming out very, very soon, because obviously over the next few weeks, many businesses will be returning to pre-pandemic operations. Do you have the proper protocols, programs, and PPE in place to ensure the health and safety of your employees when they return to work? So this is very important to us all. And please stay tuned. We'll give you notifications and follow up to let you know when this webinar is coming. It could be as early as next week or so, but contact us or keep checking at hazmasters.com or connie.com to ensure that you'll get your seat for this very important webinar that will cover all these topics, especially this most important one is when the businesses start to open up. Are you ready? So everyone who attended, thank you so much for your time. We're all doing our part to ensure that this pandemic flattens and we get to start to live a normal life safely. Thank you so much to our panelists, Matt Nichols, Karen Donnelly, and thank you to all our attendees. If you have any questions or require any assistance or services, feel free to contact us, Connie Safety and Hazmasters. You can find myself on LinkedIn, that's Sylvia Kolotsopoulos on LinkedIn, Matt Nichols and Karen Donnelly. Thank you so much for your time, everyone. Stay safe and healthy.